So, hello everyone. So, now the topic is hemolytic anemias. Okay, so we have usually questions from hemolytic anemias. So, let us see the classification first and then few characteristic features of hemolytic anemia, and then we will get into the details of few important hemolytic anemias. Okay. First thing is, to call it a hemolytic anemia, there should be premature RBC destruction. There should be premature RBC destruction. Okay, so that is the first thing. That means the lifespan of the RBC should be less than 120 days. Okay, and because there is premature RBC destruction, there should be increased erythropoietin synthesis. Okay, which will lead to increased erythropoiesis. Okay, and then the third one is, there should be increased hemoglobin catabolites like bilirubin. Hemoglobin byproducts, breakdown products like bilirubin. So, there should be RBC lysis, there should be a reactionary erythropoietin increase and bilirubin. So, bilirubin increase can manifest as icterus. If it is chronic, it can manifest as gallstones. Okay. So, all this, fine. So, now these hemolytic anemias itself, there are two types of hemolysis. One is extravascular hemolysis and the other one is intravascular hemolysis. Extravascular hemolysis and intravascular hemolysis. As the names are telling, extravascular hemolysis means outside the vessel. So, where will it occur? It will take place in the spleen. Intravascular means within the vessel itself there is breakdown of RBCs. So, whenever there is extravascular hemolysis, that means the RBCs are broken down in the spleen. So, whenever it is broken down in the spleen, the RBCs are not just fragmented like that. Okay, what happens is, the membrane of the RBCs are slowly pinched off. Okay, the membranes of the RBCs are slowly pinched off and they will lead to formation of microspherocytes. So, I want you to get into your mind that microspherocytes are characteristic of extravascular hemolysis. Intravascular means the RBCs will fragment. So, schistocytes are characteristic of intravascular hemolysis. Okay, this point should go straight. Okay, fine. So, we'll go to the next slide. So, when we look into extravascular hemolysis, see what's happening there. What's happening there exactly? Normally, red blood cell breakdown, this takes place in the macrophages of the reticuloendothelial system, that is the spleen. Okay, so what is happening here? Similarly, the RBC is broken down, the globin is then forms amino acids, the amino acids can be reutilized, iron binds to transferrin and then it can be reutilized, protoporphyrin will be converted to bilirubin and then unconjugated bilirubin enters the liver, then the same enterohepatic circulation and then in the urine it is excreted and in the feces it is excreted. This is how it normally extravascular hemolysis occurs. Okay, and the extravascular hemolysis is going to follow the same pathway. It is just that it is more accelerated when it is pathological. Intravascular means the RBCs undergo lysis here. Okay, and then the hemoglobin is released inside the blood vessel. Okay, and that hemoglobin will be converted to methemoglobinemia. Okay, and you will also see additional features of hemoglobinuria and hemosideриnuria. So, hemoglobinuria, hemosideриnuria, reduced haptoglobulin. What is haptoglobulin? Haptoglobulin is nothing but whenever there is hemoglobin which is released into the bloodstream, whenever there is hemoglobin released into the bloodstream due to hemolysis, what happens is that should be prevented from being lost, isn't it? So, that function is done by haptoglobin. This haptoglobin will bind to hemoglobin and prevent its loss from the blood. Okay, it prevents